So you've been diagnosed with an ankle sprain. Here's what you need to know and a bit of what you might like to know. So if you've had an ankle sprain and you were seen in the emergency room, you either got an x-ray which showed that you didn't have a broken bone, or you had an exam done which revealed that you didn't need an x-ray. Now, an ankle sprain is a very common injury. It usually happens when we roll our foot inward. Now, on the outside of the ankle, we have three ligaments. The front one is called the anterior talofibular ligament. The one in the back is called the posterior talofibular ligament, and the one below is called the calcaneofibular ligament. Usually, in the ankle sprain, we pop the front one, the anterior talofibular ligament, and you will actually find there's a big swollen spot there in front of that area. It's quite gushy and quite sore if you poke at it. Now, many patients want to know, well, when can I walk on it? Just listen to your ankle. If it hurts when you're putting any weight on it, then back off, use your crutches or a cane, and do that for a couple of days. And then try again. Put a little bit of weight on it, not the whole foot, but just a little bit, and slowly increase the amount of weight that you're putting on it. While the ankle's swollen, you can use ice on it to get that swelling down. So you can either use a frozen bag of peas wrapped in a towel or just some ice wrapped in a towel. Apply that to the skin where it's swollen for about 15 minutes at a time, and then release it and let your skin return to normal temperature. I've actually seen quite a few patients, well, not quite a few, but a few who've come in with frostbite because they leave it on for so long. So you do want to only leave it for 15 minutes, take it off, let the skin return to normal temperature, and then try again. The other thing you can do is keep your leg elevated. Very important to get that swelling down. You want to use gravity to help you to get the swelling down. So when you're sitting at dinner, put your foot up on a chair across from you. When you're watching TV, put your foot up. When you're sleeping at night, put your foot on a pillow. Yes, you'll roll off of it, but that's just fine. For a little while, you'll have it elevated up at the level of your heart, and it will use gravity to drain away all the swelling, and that will speed up your healing. Now, ligaments don't have very good blood supply. They're not like tendons, so they take a long time to heal. So 4 to 6 weeks to heal somewhat, and it'll be a full 6 months before your ankle is as strong as it was before you had this injury. So don't expect it to be completely back to normal within a few weeks. You can use a tensor bandage around the ankle for support after the swelling has come down, or even when it is a little bit swollen, but take it off to use the ice. But that will give it a bit of extra support while it is healing over that long time period. If the sprain was severe, you may have been given some kind of splint for it, and use that as directed. If it's not healing in about 4 to 6 weeks, then you should see a family doctor to get it reevaluated. I'm Dr. Atzema, and those are my discharge instructions for ankle sprain.